Welcome back. You're still tuned to Saudi Arabia's favorite breakfast show. Hope that all of you are having a fantastic day. And well, as we are progressing through the day, following our discussion about the Saudi-Japanese relations and this visit, which was a very special visit and a very important one of the Crown Prince, Prince Salman bin Abdulaziz to Japan, really has been followed up with the visit of this big delegation as well to promote the different areas of interest and to be having better collaboration and cooperation, especially in terms of better development of small and medium-sized enterprises within the two countries, and to be able to help and support each other. We get to see that there are so many of the countries which are trying to work towards having joint collaborations with Saudi Arabia, and we get to see that Saudi Arabia is a kingdom which is really unique with its status with all different parts of the world, because there are so many of the people around the world who are thinking about doing business with Saudi Arabia, and the Saudi Arabian General Investment Authority is really the best body to be in contact for that, and they are especially having a lot of the special programs to promote entrepreneurship, and as well as to be able to bring in more investors from different parts of the world to Saudi Arabia to be able to invest in Saudi Arabia, and as well as briefing them about their rights and about the work ethics as well. Now with this, we're going to be moving on towards our next discussion. When we talk about health in Saudi Arabia, we know that a large number of the Saudi society is affected by diabetes. Now when you have diabetes, then it is something that is going to be eventually affecting the whole of your body. In today's program, we are going to be with Dr. Muzaffer Abuzaid, who is going to be speaking to us about diabetes and oral health. Assalamu alaikum and good morning. How are you, Dr. Muzaffer?
Thank you.
Thank you very much for joining us on the Saudi Morning Show. Dr. Muzaffer, as we know that a large number of our population is suffering with diabetes and its complications. When we talk about diabetes and oral health, are the people who are having diabetes at a higher risk of having problems with their oral health?
Okay. First, we will talk about the definition of the diabetes. Diabetes is the terrible secretion of insulin. That insulin is responsible to control the glucose in the body. Why we talk about this diabetes? Because Saudi Arabia is the highest, has the highest percentage of diabetic patients in the world. This is in May 2014. In Saudi Arabia, we have more than 3.6 million cases, yes, plus than 3.6 million cases of diabetic patients in Saudi Arabia. So it's important to talk about this disease. The latest studies give us that there is a big relationship between the diabetes and the periodontal diseases, that's gum diseases. So it's important for this patient to take care of their health.
Indeed. And Dr. Muzaffer, in addition to gum disease, what other oral health problems can develop for people with diabetes? Because diabetes can kind of like make problems for everyone, for anyone with diabetes. Something a bigger problem than people think.
Yes. In the first, we can talk the periodontal diseases. That's make damage. The periodontal disease that can damage the gum and the bone. That's hold the tooth in place. The other problems, they make what's called dry mouth.
Right.
Dry mouth. It's give the patients. The site of the tooth is very sensitive for the caries. So the dry mouth is the secretion of saliva. It's in down level.
Okay.
So it's become the site of caries for these patients.
Indeed. And Dr. Muzaffer, for a lot of patients that are diabetic, some of them, they don't want to tell the doctors, or they feel that it's not important to inform the doctor that they are diabetics. How important it is, and what kind of benefit by the doctor knowing can the patient understand is something important. It's not because you just go to a general doctor saying, I have diabetes, they understand that. But when you go to a dentist, why is it so important for them to inform them that they're diabetic?
In the first, we'll ask the patient if he has diabetic or no. There is some instance that give you that maybe the patient has diabetics. For example, an abnormal movement of the teeth. That's give you maybe the patient has diabetes, and maybe sometimes the patients they don't know that they have this disease.
Now, doctor, as we talk about diabetes and oral health, tell us as to, is it diabetes that could give problems with oral health in general, or is it uncontrolled diabetes? Because when we talk about lots of the problems which are associated with diabetes, kidney problems to other problems, most of the times we understand that those are the problems of people with uncontrolled diabetes. Now, is gum diseases and the periodontal diseases, as you were talking about it, a problem for people generally with diabetes, or the ones with uncontrolled diabetes?
No, of course, of the uncontrolled diabetes. So the other people, it's the same. And you know that the diabetes is 3 types. There is difference between the patients that they have to control the blood sugar, or they didn't take care of their health.
Indeed. And doctor, how can someone know if they have a serious gum disease? Are there some symptoms that can pretty much give them an idea, say, I need to go to a doctor because something's wrong?
That for the dentist, that's mean?
How can they understand or know that they have a serious gum disease? Is there something a clue that they can give them, or a symptom?
Yes, you know that's the bleeding, gum bleeding. There is a movement of the teeth.
Okay.
You can see this is some symptoms. You give you idea about the patients that he have diabetes. He can make control for, he make analysis for his blood, and he will know that he has or no.
Indeed, because I'm sure that you see many patients, and when they come, this is like I'm eating an apple and the teeth just falls out. This is the most common scenario that many of the patients give you when they have gum disease, and they're not aware of it. They just kind of ignore it when they have bleeding in the teeth.
Maybe the person, I think, no, they know that they have the problem.
And what is the first stage of gum disease? Is it just like you mentioned, just bleeding of the gums, or something else?
Yes, the first is bleeding, what's called gingivitis.
Gingivitis.
That's the problem, the bleeding, gum bleeding. If the patient, he didn't make the accumulation of calculus, we call, or tartar. There's, if the patient, he didn't come to the clinic to clean the starter, the gingivitis become periodontitis. Periodontitis, that's meaning the periodont become losing that bone, and sometimes in the last we will lose the tooth.
Yes. And doctor, we'll continue discussion, but we will also be taking a short report. We'll be joining right to this. Stay tuned.
It's no secret that diabetes is on the rise. Whether you have the condition or believe you may be at risk, there are things to keep in mind to stay mouth healthy.
Diabetes can affect your oral health. That includes your mouth, your teeth, your gums. In fact, there's a scientific study that shows people with uncontrolled diabetes are more likely to lose their teeth.
A study in the Journal of the American Dental Association found that diabetes is linked to 1 of 5 cases of total tooth loss in the United States.
If you have diabetes or a family history of diabetes, it's very important to let your dentist know.
Practice good mouth-healthy habits. Brush for 2 minutes twice a day. Floss once a day. Eat healthy, nutritious foods. And most importantly, see your dentist regularly for exams and dental cleanings.
Managing diabetes is very important, so make sure that you have a plan to stay mouth healthy.
Welcome Welcome back once again. You're still tuned to the Saudi Morning Show. We are having a discussion which is about diabetes and oral health with Dr. Muzaffer Abuzaid, who's joining us here in the studio. Dr. Muzaffer, as we have been speaking to you about diabetes and oral health, we see that there are so many of the things that the diabetic people need to be careful about. But could the people who have diabetes and who are suffering through its complications, by taking good care of their oral hygiene, continue to have good oral health?
Of course, it's important. There is a relationship between the health and the take care of the blood sugar, the brushing of their teeth, flossing, and we will talk about if there is some patients with diabetes, they have that false tooth. They will make visiting for doctors if there is any problem in their denture or false tooth.
Indeed. And Dr. Muzaffer, what % of adults get gingivitis or gum disease in their life? Is there something like a low percentage, or is it more common than people think? What percentage of adults get gingivitis and or gum diseases during their lives?
I don't know.
What percentage of adults get gingivitis?
There is a high percentage because they sometimes the problem of the alimentary, the health, they didn't take care of their health. Maybe the alimentary, there's a problem. Will give us an idea about the problem in mouth.
Indeed. And around what age does gum disease usually start?
So there is a problem. There is different kinds of diabetes. Sometimes there is, but I think that's from 30 to 60 years.
Because I'm sure, like doctor, like nowadays, like you see, diabetes is also attacking even the young ones, like early
Yes.
ages, 12, 15. So can they start having?
It's hereditary. Sometimes there is from their parents. They take it. Sometimes now. In 1 or 2 years they have the diabetes.
But can they also affect, especially the young ones, say about 10 years
Of
old,
course,
15?
the take care of the tooth from there appears.
Okay.
If there's from 2 years, 3 years, they have to brush to take care of their tooth.
So as good hygiene can make a huge prevention for gum disease and gingivitis.
Yes, of course.
I'm sure a lot of the viewers, they think it's like you just brush like once a day or twice a day. It's not only that. You have to floss, you have to take care of your health. You also have to visit the dentist regularly, because you just doing it at home it's half the success story. You have to also visit the dentist regularly, once a year or twice a year, to avoid any issues, whether you have cavities, avoiding sugar, exercising correctly, because I'm sure some of the things like just brushing, flushing, and the flossing that's all. I'm okay with it. But at the end, when they go to a doctor for many like gingivitis or gum diseases, they realize then it's like overall health is very important.
Yes, I think that's the patients, especially for the diabetes, has to visit the doctor once every 6 months at least, because the doctors can see another thing that the patients can
Yes.
see it. Sometimes there is a small superficial caries, there is a problem in the gum. He will give the patients the way to how to take care of his mouth. It's important, but also the main role is for the patients. If he didn't take care of his mouth
Yes.
at home, the doctor will not make anything.
Indeed, of course, it's very important, because like doing at home, taking care of your own stuff it's like the biggest prevention. Many doctors say it's like you have to take care of yourself, follow the rules. Like I'm giving you what to do, and you'll be like in good shape, and just come regularly back to me in case anything happens. Thank you so much, Dr. Muzaffer, for joining us today. It was an absolute pleasure. Any last word you would like to tell the viewers?
I will thank you for inviting me here.
Thank you so much. And dear viewers, that was Dr. Muzaffer Abuzaid. We were discussing today about diabetes and oral health. If you have any questions, share with us on our Facebook, Twitter, and email. At the moment, we'll be taking a short report, and we'll be back to conclude today's episode.